So again, important topic. I would say this is again an important topic for the INSET, as every year we are getting a question from the anti-glaucoma drugs. From the anti-glaucoma drugs. So we know that whenever there is glaucoma, see a simple concept. If I have glaucoma, there are only two ways. Either there can be more aqueous formation. Either I can have more formation or I can have less outflow, right? So that means when I am giving the drugs to reduce the intraocular pressure, they can also work by two methods. Either they will decrease this aqueous formation or they will increase this aqueous outflow. Very, very clear. Now we will talk about the mechanism of action of the different anti-glaucoma drugs, right? So though everything about the anti-glaucoma drugs is important, okay, so whichever question is coming from whichever topic, like this question is from anti-glaucoma drugs, so you have to read whole of the anti-glaucoma drugs, okay. So it's of the aspect also, pharma aspect also, but because this question is on mechanism of action, so I'm going to discuss all the mechanism of actions. So see here, decreased aqueous formation. So decreased aqueous formation, like one is your example is the beta blockers. Beta blockers are acting on the beta receptors which are responsible for the aqueous formation. So obviously they will decrease the aqueous formation. Then number two, we also have the carbonic anhydrase inhibitors. Carbonic anhydrase inhibitors are acting on this enzyme carbonic anhydrase which is responsible for aqueous formation. So they are also going to decrease the aqueous formation. Now if I talk about the alpha adrenergic analogs, okay, if I talk about the alpha adrenergic analogs, so always remember that they have the double mechanism of action or dual mechanism of action. So they are decreasing the aqueous formation and plus they are also increasing the aqueous outflow. Okay, now if you talk about the two different drugs, one is from selective and one is your non-selective. So we have got two kind of drugs here. We have got epra-clonidine and we also have the what you call as the brimonidine. So if you talk about these two drugs, both of them are having the property of decreasing the aqueous formation. Both of them are increasing the aqueous outflow. Like A for is epra-clonidine and B is your brimonidine. And always remember this thing that brimonidine is otherwise also very, very important drug. Now always remember the mnemonic AT and then we have got BUS, bus. Okay? So basically it is this epra-clonidine which is increasing the trabecular. AT, T for trabecular, while US is uveoscleral. So this is increasing the uveoscleral. This is increasing your uveoscleral outflow. And don't miss anything about this brimonidine. Very, very important. This brimonidine is useful as a neuroprotector drug. It is very, very important. It is the only anti-glaucoma drug which is giving you neuroprotection. It is also a CNS depressant. And you will get that if you go even back, go to the AIMS PYQ, you will get many questions that it's a CNS depressant. So which drug causes the apnea or which drug causes the drowsiness? It's very, very important. Which drug is contraindicated in the infant? So in all these conditions, your answer will be the brimonidine. Answer will be the brimonidine only. Now talking about the next, that was your hyperosmotic agents. So if I talk about the hyperosmotic agents, obviously these drugs are, acting by decreasing the vitreous volume. So they are not decreasing the aqueous formation or they are not increasing the aqueous outflow. So answer is not this also. And finally, we have got what you called as the Rho kinase inhibitors. Finally, Rho kinase inhibitors. So in this Rho kinase inhibitors, who will tell me the example of Rho kinase inhibitors? Anybody? What is the example of Rho kinase inhibitor? They have got three mechanism of action. So whenever you do not get any drug which is acting by any of the actions and this is given, so answer will be this only, because we have got all three mechanism of action. They are decreasing the aqueous formation, and they are increasing the trabecular outflow, that will be your answer, and decreasing the episcleral venous pressure. Yes, very good. It is nitarsudil. And anybody who can tell the side effect of nitarsudil? So if you look at the question, which of the following drugs is acting by increasing the trabecular outflow? Timolol is a beta blocker, so this will decrease the aqueous formation, right? Then acetazolamide is a carbonic anhydrase inhibitor. This will also decrease the aqueous formation. Brimonidine is a bus, uveoscleral. Therefore, answer is the nitarsudil. Very good, Kamran. So the side effect here is the vortex keratopathy. Yes, you are also correct. Vortex, everybody has given the right answer. Very good. It is the vortex keratopathy, or it is also called as the cornea verticillata. Vortex keratopathy or the cornea verticillata.